Hi, welcome to Case of the Day. Today is Tuesday. We're on our 81st case titled High Density Foci in the Lungs. And so I was reading this today. A 57-year-old who had presented with cough actually came for a second opinion. And we see these clustered centrilobular nodules suggestive of an inflammatory infectious bronchiolitis. But there were also these high density foci that were clustered mainly within the lower lobes. And you can see them with green arrows here. And if you look at the soft tissue images, these are much better appreciated. And the question is, what is the cause? And there's a long, long list. But these are not granulomas. I think that's quite clear. There's no surrounding fibrosis. It's not varicella. They would be more punctate, and they're very. I don't think I've seen a varicella, calcified nodules in a long, long time. Metastatic calcification occurs in patients who typically have uremia, so that's not there. And these are not bullet fragments at all. They're not that high density. There are no artifacts that you see. So you're basically left with these. Pulmonary alveolar microlithiasis is very different. It's an interstitial lung disease. We will see septal thickening. We see this subpleural line with a mark effect that causes these apparently cystic areas to be seen. And on the soft tissue images, the calcific foci are seen along the septae and along the perivascular interstitium. So that's different. And I had done a whole case. I think this was my third case when I started ctchestreview.com, and you can view it if you'd like to. The multiple cases of PAM. The other entity that can look like this sometimes is diffuse pulmonary ossification, and this is the idiopathic variety, and I'd done this as case 70. But you can also get DPO as part of other interstitial lung diseases. But in those cases, there is an underlying ILD, and then we see these ossific foci, which are typically interspersed with the interstitial lesions. And clearly, that's not the case here, too. But they are high density. So is that mercury poisoning, Lipiodol, barium? These are the ones that are left. Mercury poisoning is different. And I had this case 34 where we had this patient who tried to inject themselves with mercury. And you'll find the mercury high density foci not just in the lungs but in multiple other places. One of the areas is along the RV, endocardium, and then in the liver, kidney, etc. So this is not mercury. Again, if you see, they are not the same sized tiny nodules. They're of differing sizes, but more important, they are clustered and they appear to show a tree in bud appearance, and they're centrilobular. These are MIP images that I've used here. And if that's the case, then Lipiodol is out, because Lipiodol would be an embolism, and so you would not see a clustered tree in bud like appearance. So this patient turned out to have a swallowing difficulty, and then we found that there was a barium swallow that had been done 3 months ago, and you can clearly see aspiration into the trachea, the bronchial tree, and predominantly in the lower lobes, which is why we're seeing those residual barium foci in the lower lobes. And this is what basically it is. It's aspirated barium appearing as clustered high density centrilobular nodules. And because it has a centrilobular appearance, we know that it's airway related, and that should help us differentiate from other entities. And this patient is clearly aspirating now. That's why the inflammatory bronchiolitis that we're seeing. And then obviously that would need to be taken care of. That's the classroom, the WhatsApp channel. Thank you so much for viewing this.